My name is Shelby Boone, and I did my movie project on Split. So, some description. So, first of all, our main character's name is Kevin Wendell Crumb, and he has dissociative identity disorder, meaning he lives with 23 personalities in his one body. So these personalities came about kind of as a coping mechanism from his childhood. He was very abused by his mother mentally and physically, and so these personalities kind of became a source of comfort and a coping mechanism for him to live with. So he has 23 different personalities, but we see a couple main ones throughout the movie, including Dennis, who kind of seems to be one of the leaders of the body. He's very organized, he has OCD, he likes things to be neat and go well. There's also Hedwig, who's a 9-year-old boy, and the Beast, who we see kind of gradually come out of him throughout the movie. So the main point and the description of this movie is that his personalities, Dennis and Patricia, kidnap 3 young girls and hold them hostage, and interact with the girls as many of the different personalities. And they do this because they're preparing for the arrival of the Beast and want to use these 3 girls as kind of a sacrifice and an offering to welcome the Beast to kind of take over Kevin's mind. So the culture of this movie, it's really seen through themes of mental disorders, specifically dissociative identity disorder, and how they affect lives. It shows how it affects Kevin's life. It shows how it affects his doctor's life, 3 girls he kidnaps, and so on. The setting is in Philadelphia, but the movie really takes place in Kevin's kind of underground lair or hideout where he lives in order to keep his personalities kind of in one place, but also where he keeps the 3 girls that he's captured. So diagnosis. Kevin is clearly diagnosed with DID due to having multiple personalities in his mind. It's clear by the constant switch up of personalities in his mind, grabbing the light. So when Kevin was having a meeting with his specialist, Dr. Fletcher, he kind of describes the characters in his mind like switching up by grabbing the light. And once they grab the light, they kind of take over the body. Some personalities also of his would kind of have their own mental disorders, like Dennis has OCD, so that could also be diagnosed. If a therapist were to diagnose Kevin, he would obviously be diagnosed with DID, but I also think he would be diagnosed with PTSD because he has a lot of trauma from his childhood that clearly stuck with him throughout his adulthood, causing the personalities. Many cultures around the world would recognize DID as a serious mental disorder. Some cultures may see this personality as something spiritual or perhaps supernatural, but overall it's pretty clearly recognized around the world. So there's 2 main things of evidence that Kevin does have DID. One of the main ones obviously being his multiple personalities. They would often come out of nowhere or from a specific change in the environment that would activate that one personality. Another symptom that's really shown is just his mood swings. He'll go from 1 second being very childish and goofy to all of a sudden just being manipulative, controlling, and extremely organized, kind of like a switch from Hedwig to Dennis. And then one symptom that someone with DID might show that Kevin did not show throughout the movie is self-harm. Kevin really had his problems, but I didn't get at all really from the movie that he wanted to really hurt himself. Treatment. So Kevin could undergo several treatment plans, one of them being cognitive behavioral therapy to help him understand what is leading to specific behaviors and how to control it. In the movie, he does see a specialist named Dr. Fletcher, who is an expert in DID. She does help him talk about his condition, but I think he should probably go under some more intense therapy. He could also go under family therapy if he wants some loved ones surrounded by him, but this wasn't shown in the movie. Medication could also help. It doesn't get rid of DID at all, but it does possibly help lessen his symptoms of possible depression or anxiety. Finally, a broader perspective. I think that DID is not accurately portrayed in this movie. I think it brought good attention to the disorder and people that have it, because I think a lot of people kind of tend to take it unseriously, but I do think this movie tended to dramatize it a lot, because people with this disorder don't always have a violent personality and don't kidnap people. I also think that the portrayal of mental disorders in most films make many people see someone with a disorder as less than others and extremely different. It does make a lot of people's life harder, but they are still humans. So this is my movie project. Thank you.